Chemotherapy can feel like a journey to a distant planet. Everything is unfamiliar at first and completely different from what you're used to. That's why the doctors now take extra time to thoroughly discuss the procedure with you. The exact approach is typically defined in what's called a treatment protocol, which is based on the latest research findings and clinical experience. For many treatment protocols, there are actually overview plans that also include a kind of timeline. It's a bit like a timetable or a project sheet, so it's really just an overview plan with a timeline where you can see what happens when. And that's really super practical because this way you can see what you've already accomplished and what still lies ahead. So you could also say it's a kind of small motivational aid, so to speak. So now the question is, how does the whole thing actually work? So now we're going to go through that step by step. So first of all, it's important to know where. Yes, where is the chemotherapy carried out? That, of course, depends entirely on the specific situation, mainly on which medications you're receiving and how they are administered. If the chemo consists of multi-day blocks, then you usually have to go to the hospital. Yes, for several consecutive days, meaning you stay on the ward. However, between these blocks, there are often several days or even weeks during which you don't receive any chemo medication and can go home. So before the next round of chemo begins, there's a very thorough check to see how you or your child are doing and what the blood values look like. Other therapies consist of much shorter infusions. In that case, you can either go to a day clinic or only need to stay in the hospital for 1 or 2 nights. And if the chemo medications are taken as tablets or as a syrup, then of course it's also possible to be at home for that, yes. So it always depends. Definitely something to discuss thoroughly with the doctors treating you. And that brings us to the next question, namely how? Yes, how do the cytostatics, in other words the cancer drugs, get into the body? As mentioned, there are substances that can be taken as a regular tablet or, for example, as a kind of syrup. If they don't taste that good, you can sweeten things up a bit, literally, by taking them with a tasty drink or use a few other tricks. The nursing staff is very skilled at that. They have lots of good tips. However, many cytostatics are also administered directly into the vein. In that case, the doctor can administer the medication directly into the vein. That's something people are familiar with. The vein is essentially punctured for that purpose. That's also called an injection, or the medication is given as an infusion. That means the medication is in a bag, which is then hung on a stand, and the whole thing flows through a tube into the vein. So it's not administered directly, but rather it flows through a tube over a somewhat longer period of time. So to avoid constant needle pricks and to prevent the vein from being punctured repeatedly, a catheter or a port system is usually inserted at the beginning of chemotherapy. This allows the medication to be administered through it. A minor surgery is performed beforehand to place the catheter or port under the skin. So what happens is that, for example, under the collarbone, they look for a spot where the port can be placed, and then it can be easily accessed from the outside with just one needle prick. This way, there's no need to puncture a vein each time. This is much more comfortable for many people, but I'll explain that again in a separate video. You can take your time and watch that. So, for an infusion, the nursing staff sets the duration using a pump. So either, as I said, a bag is used, but it can also be that a syringe is filled and then placed into a machine. It's not pressed by hand, but rather the machine pushes it at a certain speed. Let's say there are 50 milliliters in it. Then it's set so that these 50 milliliters are slowly pushed by the device and, for example, administered over 15 minutes. Or over hours or even days, everything can be adjusted. That, of course, depends on which medication is being administered. And don't worry, an infusion like that hangs on a stand that also has wheels. That means your child or you as a teenager can get up and basically walk around with the stand and move around the ward or the outpatient clinic. In some cases, cytostatics also have to be administered into the brain or spinal fluid. This is done to bypass what's called the blood-brain barrier. Yes, that's because the blood-brain barrier is actually a barrier that prevents everything in the blood from directly entering the brain. To protect it, in cases of leukemia and lymphoma, medications are then administered into the spinal fluid through a small injection in the lower spine area. That means the spinal or brain fluid, referred to as cerebrospinal fluid, is where the medication is introduced. And in the case of brain tumors, the medications are also administered directly into the fluid-filled spaces in the brain so that they are simply right where they are needed. And that also happens through a kind of port that is located in the scalp. So even in that case, everything is already set up in a way that it doesn't require a huge effort each time. So now we finally come to the very important question. How long does chemotherapy actually last? That again depends heavily on the type of cancer. For the most common types of cancer in children and adolescents, or for the most common one, acute lymphoblastic leukemia, also known as ALL, I'll give you an example of how it typically works. The entire chemo, meaning everything altogether, usually lasts about 2 years. However, it takes place in phases. You can also see that on this chart. It shows exactly what happens when. And during the very intensive initial phase, which is also called the induction phase, you spend the first few weeks in the hospital. After that, you can go home between therapy blocks. And after about a year, a milder chemo follows, the so-called maintenance therapy. Its purpose is to prevent the disease from coming back. So the disease shouldn't return, and that's what the maintenance therapy is for. And during this phase, only 2 to 3 medications are taken, either in tablet form or as a syrup, to fight the leukemia. This can also be done from home, for example. And you only need to go to the clinic for regular checkups. It's likely that you or your child can even go back to daycare, school, or whatever the case may be. That's the moment when hopefully you return to your everyday life, and it starts to feel almost normal again.